السلام عليكم ورحمة الله تعالى وبركاته. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. And welcome to the Islamic Medical Association of South Africa's Health Matters Comprehensive Chat. I'm your host this evening, Najwa Mohammed Luddy, and I'm so honored to be once again in your company, alhamdulillah, on the 8th day of Muharram 1437, and we want to wish each and every one of you Muharram Mubarak, and may only goodness come from this beautiful brand new year. With me in studio, I have the Honorable Dr. Abdul Aziz Parker, an emergency physician. Assalamu alaikum wa rahmatullahi wa barakatuh, Doctor. Shukran once again for joining us here, alhamdulillah. Our topic of discussion to all our viewers is CPR, or the other word, or better known for cardiopulmonary resuscitation awareness. And the doctor will definitely do his best to answer any niggly questions that you might have regarding CPR, inshallah. But before we start off our program, let's do the tarbiyah of tonight's program, inshallah. Bismillahir Rahmanir Rahim. Allah Most High says, He, Allah, has only forbidden you dead meat and blood and the flesh of swine and that on which any other name has been invoked besides that of Allah. But if one is forced by necessity without willful disobedience, nor transgressing due limits, then he is guiltless. For Allah is most forgiving and most merciful. That is Quran chapter 2 verse 173. The famous principle of Islamic jurisprudence based on the teachings of the Quran and Sunnah permit the use of unlawful things in cases of extreme need and necessity. Denial of faith when life is in danger is also covered in the Holy Quran. Anyone who, after accepting faith in Allah, utters unbelief except under compulsion, his heart remaining firm in faith, but such as open their breasts to unbelief on them is wrath from Allah, and theirs will be a dreadful penalty. Quran chapter 16 verse 106. Our jurists have extensively debated when the impermissible becomes permissible. There are two conditions attached to this. Firstly, we should be compelled to do the specific impermissible action, meaning that we cannot find anything with which to meet that necessity except this impermissible act. If we can find something else, then it does not become permissible, even though it could meet our necessity. If non-halal meat is the only means of preserving life, it is permissible. But as soon as any other of halal sustenance becomes available, that meat becomes haram immediately. Secondly, the necessity should be met by the impermissible. If that is not the case, then it remains haram. If we are not certain whether it will meet the necessity or not, then it also remains haram. That is because doing something haram is definitely wrong, and meeting necessity by means of it is something concerning which there is doubt. So we should not transgress by doing that which is definitely haram for the sake of something concerning which there is doubt. Carrying an unconscious but immodestly clad lady from a burning room is permissible, as the threat to the life is removed. First looking for a blanket to cover her could lead to her sustaining serious burns. As soon as it is removed to a place of safety, attempts should be made to cover her if possible. When Muslim doctors in emergency situations, there is relative consensus that impermissible sustenance may be used in matter of life and death situations when no alternatives are available. Allahu a'lam. Allah knows best. MashaAllah, that was so beautiful. And before we start our program, let me enlighten all our viewers regarding the highlights of the IMA. As a reminder, the Islamic Medical Association's annual graduation and fundraising gala event, it is a great pleasure for us to extend an invitation to all Muslim healthcare professionals, graduates and postgraduates of 2015 to attend our forthcoming annual graduation and fundraising gala dinner function. This is a national event and dates for each region is as follow. In Pretoria, it will be on the 1st of November 2015. In Johannesburg, it will be on the 22nd of November 2015. In Durban, it will be on the 25th of November 2015. And in Cape Town, it will be on the 2nd of December 2015. But you are most welcome to contact your local IMA officers for further details. In Cape Town, the numbers 021 762 1414, and in Durban it's 031 207 2250. In Johannesburg or Pretoria 011 837 6717, as it appears on your screens. And we wish you well with your upcoming examination. May Allah Almighty make your task ahead easy, bless you with sound health and vitality, to remain calm and focused, and may your striving be rewarded with a successful outcome, inshallah. Shukran so much to our viewers, and of course to my doctor as well. We're discussing CPR this evening, and you are most welcome to contact us on the telephone 02169600109, anything relating to CPR with our specialist in studio. He's an emergency physician. Doctor, let me start off by asking you the first question. What should I know regarding CPR?
So CPR doesn't happen to a lot of people very commonly, so it's a rare event. And the first thing that we want to do when something happens that we need to perform CPR on is we panic. Even as doctors, we don't see patients requiring CPR regularly, and we've simplified it. So we make things automatic for doctors needing CPR, or doctors requiring to perform CPR at least, and we shorten it down to acronyms. You're allowed to get flustered for about 5 seconds and then move on after that. And as we're progressing through the talk, I'll explain everything as we go. The first thing we need to realize is there's 3 H's that we start off with. First H is, so it's a breathe. Okay, and with that it's hazards. So make sure that you're in a safe environment, because it's pointless that the patient's already suffered an injury. We don't want another person being injured trying to rescue that person. So make sure that you're in a safe environment. So if you're at the roadside trying to assist somebody that needs CPR or that needs help, make sure that you're in a safe environment, that there's no petrol burning, that you're not going to catch a light, that the traffic is not going to cause you injury. Then after that, you go and see, does the patient actually need help? Does the person need help? You hello and rub him and stimulate him. And if they wake up and say, I'm actually okay, then good, then you move on. But if they're not responsive, then you're going to move on to the next H, which is help. And as we discussed last week, our number that we have to phone from a cell phone, any mobile phone, is 112. And if we on a landline, it's 10177.
Okay, all right. And of course, the details appeared on the screens now, Doctor. So that is very good advice to all our viewers. The lines are open immediately. You are most welcome to call us on the number that appears on your screen, 02169600109. Anything relating to our topic, which is CPR this evening, inshallah. Doctor, I've heard the term already, chain of survival. Yes. Could you maybe just explain, to all our viewers, what exactly does that mean?
Yeah, so chain of survival is, again, just telling us what we need to do. So it's a visual reminder of what we need to do. And the first, we've got 2 chains of survival. The one's an adult chain of survival, and then we've got a pediatric chain of survival. The adult chain of survival starts off with asking for help or calling for help. If there's more than one person, somebody can initiate CPR while somebody is phoning for help, phoning 112 or 10177. The problem is that so CPR is just a temporizing thing until we can find a permanent resolution to cure the person, basically, and to change the heart rhythm. And what we need to do is we need to get somebody with a defibrillator, and I'll explain a little bit about the defibrillator a bit later on. We need to get somebody with a defibrillator to restart the heart again. If you are alone, you have to leave the patient, phone 112, get the help to you before initiating CPR. And as I said, if there's more than one person can phone 112 and the other person can start CPR. In a child, it's slightly different. The chain of survival in a child, as an image, there's a graphic that will come up soon. But the chain of survival in a child is prevention. A child's not going to die of a heart attack. They don't just fall down and die of heart attacks. The chain of survival in a child is prevention of cardiac arrest. So don't let them drown. Buckle them up when they're in a car seat. And then you start CPR first before phoning for help, because a child needs CPR beforehand. And if we go on to the next slide, you'll see the differences between an adult and the pediatric chain of survival, where an adult you phone first, whereas with a child you prevent, then you start CPR, then you phone for help before. So starting CPR before phoning for help.
Okay, fantastic. So the chain of survival is very, very important for us to follow.
Definitely.
Is that right, Doctor?
Yeah.
Doctor, we need to go for our first ad break of this evening, inshallah. But of course, I want to encourage all our viewers, please call us 0216960109. Anything relating to CPR this evening, and the physician, emergency physician, is in studio to discuss anything relating and answer those niggly questions that you might have, inshallah. But inshallah, after the break, I will also be asking Doctor a few questions, like why is CPR important? You know, how long should we do it? Can somebody that's not medically equipped do CPR? But that we will discuss right after the break, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to the Islamic Medical Association of South Africa's Health Matters Comprehensive Chat. I'll be discussing CPR this evening, and you are most welcome to call us. The telephone numbers will be appearing on your screen, inshallah. And for those that's visually impaired, the numbers is 021-696-0109. Most definitely, please call us, and Doctor will be honored to answer any questions regarding CPR. Doctor, I want to know, and I'm sure many of our viewers out there would love to know, why is CPR so important?
Okay, so CPR is done when the heart is when you don't have a pulse.
When you don't.
Yeah. So we're not going to do CPR in a person that is sleeping. We're not going to do CPR in somebody that is just not breathing.
Yeah.
Or shows signs of life. So they're still breathing. So with somebody, when we're assessing somebody for CPR, we essentially saying that they are dead. Okay. And what we want to do is we want to temporize them until we can get definitive therapy to try and restart their heart. So the heart has stopped completely, from what a layperson will see.
Yes.
And what we essentially want to do is we want to buy time and get blood to the brain and to perfuse the heart as well, while we're getting definitive therapy. So if we look at the first video is a video of blood flow demonstrating blood flow during CPR. So what we're doing during CPR is we are pushing on the chest, which compresses the heart. So when we compress the heart, the graphic should, there you go. So the graphic should be coming up, and what happens is the person falls down, and we are compressing the chest, and by compressing the chest, we are pushing blood out of the heart, and that perfuses the brain. So that makes sure that that blood is perfusing the brain, and the brain in oxygen and sugar, and it ensures that the patient doesn't have long-term effects from that cardiac arrest, and it improves the chances of the patient's heart also returning to a normal heartbeat afterwards, once we have initiated definitive therapy.
Doctor, how does a person that does not have any medical background, how do I assess CPR really?
Okay, so the next video, so we've got it. So the first video that we have, it's a video demonstration that we filmed a bit earlier on,
Okay.
and the first video shows us how we assess. So we have a look around and make sure. Again, we go through our hazards, hello, help. So the first video should be coming up soon. Can you say hello? So here we're just assessing and looking for signs of breathing, for signs of life. And if you don't see any signs, so you don't feel for a pulse. So it's very important
please,
that...
Can you phone 112 and get help, please?
So make sure that we don't feel for a pulse. And if somebody can phone for help, then that's good. We've put our hands on the breastbone at the level of the nipples. And this is how we use a mask. So we'll talk a little bit about mouth to mouth, but preferably if we do have a mask, a mouth shield, a face shield at least, this is how we use it. So we close the nose, pinch your nose closed, otherwise the air is going to go out of the nose. And we seal our mouth around the patient's lips. And then we get good chest rise. So let's just summarize that again. We make sure that we're in a safe environment. We assess the patient, so it's hazards, hello, and then we call for help. Once we've called for help, we're going to reassess and look for signs of life for at least 10 seconds, so no longer than 10 seconds. Every minute that we're off, that we're not doing chest compressions, the chances of that patient dying is increased by 10%. So we want to start it as quickly as possible. If we don't initiate CPR within 10 minutes of the patient collapsing or the patient's heart stopping, there's no chance of that patient coming back again. So we have to initiate it as soon as possible. And let's just recap that first one. It's hazards, make sure that you're in a safe environment. Assess, make sure that the patient needs help. Call for help. Look for signs of life, which is breathing.
Yeah.
And if the patient is gasping, so what is gasping? Gasping is, so we say look for signs of breathing, but sometimes the patient does this. That's not normal breathing.
Stop.
Yeah, exactly.
They gasp and they stop.
So
Right.
and it's long stoppages.
Yes.
That's not normal breathing.
Okay.
And so if the patient is gasping, that's not normal breathing, and that is an indication to start CPR.
Okay.
Lots of people will think, oh, but what if I start CPR and
Yes.
the person wants to sue me? For a lay person, you are covered by the Good Samaritan clause. They
Yes.
cannot sue you. As a medical professional, we need to be able to assess and see whether or not somebody does need CPR. So from a lay person point of view, you are completely protected if you are doing it with the proper intention
Yeah.
of trying to assist the person. So there's no legal recourse if you are starting CPR.
So if you see that person is gasping,
Yes.
and there's obviously, as Doctor just mentioned, you need to assess the situation
Yes.
as well, very important. And if you see there's a gasp, that is when you can actually initiate the CPR.
Yes. So if there's no breathing, or if there's only gasping, then initiate CPR. If the person says, hey, I'm actually okay, then obviously stop.
Then obviously, yeah.
But in 99% of the times, the person's not going to be able to communicate with you. They're going to be pulseless, but don't feel for a pulse, because we waste a lot of time trying to feel for a pulse. Where should I feel for a pulse? Should I feel here? Should I feel higher up? Should I feel lower down? Don't feel for a pulse. Just look for signs of life. If the patient's not moving, if they're not breathing, or if they're only gasping, start CPR. And don't doubt. If the patient then wakes up, then stop CPR at that point.
And Doctor, time is of absolute essence
Yes.
here. As you mentioned, if it's between 8 or 10 minutes and there's no life,
Yeah.
then you cannot revive that person.
If you have not started CPR 10 minutes after the person has collapsed,
Yeah.
then it's pointless. So as I said, each minute that we delay starting CPR, the person's chance of dying is increased by 10%. So if I collapse in front of you now, poof,
Right.
and you start CPR on me, my chance of survival is more than 90%.
Yeah.
If you started 1 minute later, it's 90%. 2 minutes later, 80%.
Yeah.
3 minutes later, 70%. 10 minutes later, I've got no chance of surviving. That's why it's so important not to wait for somebody to come and start CPR.
Yeah.
It's so important for somebody the bystander, start CPR. By the time the ambulance comes, so if the ambulance takes 10 minutes to come, you have started CPR, so the person actually has a good chance of making it. Whereas if you hadn't started CPR, they came 10 minutes later, there's no chance of that patient making it.
Doctor, can you do CPR actually incorrectly by damaging the patient or the person? Because I think that will probably be our fear.
Yeah. So this is a fear that most people have, and the person's dead already. You can't make the person more dead than dead.
Yeah.
There's just nothing.
Yeah.
You might cause a little bit of trauma in somebody who doesn't need CPR, but there's no irreversible trauma that in a person that has a pulse. So the default position should be start CPR. Okay. If the person then starts showing signs of life, always stop. But if you're delaying it, there's no coming back.
Yes.
If you're delaying it by 10 minutes, there's no chance of recovering that 10 minutes that you didn't do CPR.
Yeah.
So from a layperson point of view, you don't know, you're unsure, start CPR, you can always stop it, but you can never take that 10 minutes back.
That's correct, yeah. Thank you very much, Doctor. 0216960109, that's the number for you to dial. And we're discussing CPR this evening. Be part of our program, anything relating to our topic. The specialist is live in studio, in the Cape Town studios, I must also say, mashallah. And it's a beautiful day outside. It was a beautiful day. And I'm sure all our viewers are enjoying our program, alhamdulillah. Doctor, we saw the visuals now while but you're an expert, you know, and we saw what you did basically. Can you maybe just explain to our viewers again, how do we actually start CPR?
Okay, so we'll start now with the next video. It's video 2. And what you have to do is after you've assessed, so we've gone through the hazards, hello, help. So after you've assessed, you're going to have a look and see, okay, this person does need CPR. So the video should be coming up anytime soon. And what you do is you place your hands one on top of the other over the breastbone at the level of the nipples. And you see how I'm pulling my hands up there?
Yeah.
And you've got to press as hard as you can, as deep as you can. So you want to press at least 5 centimeters deep, and you want to go at the rate of 100 beats a minute. So how many chest compressions do? We do 30 chest compressions. And then we've got a mouthpiece, and you'll find this mouthpiece in most first aid kits. We insert the mouthpiece, close the nose, lift up the chin, encircle the entire mouth, 1 puff, and you can see the chest rising nicely, 2, and immediately back. And there you go, 1, 2, 3, 4. So what tempo should we go at? If we go too fast, we're not going to press deep enough. If we go too slow, the patient's not going to get enough blood to their brain. So here's the Bee Gees.
Yeah.
And it's that famous song of theirs, Staying Alive. So if you can remember the tempo of it, I'm not going to sing anymore because I don't sing very nicely.
I think you're making it very real to the to the viewers out there. Doc.
So it's that tempo. It's that there you go. So it's that tempo that you want to go at. And it's 30 compressions, 2 breaths. If you don't get the chest to rise with that 2 breaths, don't worry. Just continue doing your chest compressions, because every time you're pressing, you're moving air in and you're moving air out.
Yes.
So as you're pushing in, the air is going out. As you're coming up, the air is coming back in again. So you're actually passively breathing for the patient.
Yes.
So the breathing part is not as important as the chest compressions. The chest compressions are vitally, vitally important. Okay. So don't be too stressed about not breathing for the patient. We do 30 compressions, 2 breaths. We do it 5 times, okay? And then we switch, because this is excessively tiring.
Yes.
I do this all the time, so I'm used to that.
Yes,
but even I get tired. After
yes.
5 cycles, I get tired.
Right.
So we do 32, 32,
right.
5 times. And when we're done, we get somebody else to do the chest compressions, and somebody else can do the breathing. So we switch every 5 cycles, basically.
Right, right. To our viewers, I'm sure you can see the telephone number on your screens, 0216960109. We're discussing CPR this evening with the honoured doctor live in studio. We've got a caller in line. Let us go to the lines. Assalamu alaikum and welcome. Assalamu alaikum. I think we've lost that call. I'm so sorry. Please call. We will try also to establish that call on 0216960109. Doc, I think we need to go for another ad break, inshallah. But all our viewers, stay with us and pick up that call phone and call us 0216960109, inshallah. We'll be back right after this break. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to the Islamic Medical Association of South Africa's Health Matters Comprehensive Chat. We do have a caller online, and let us go straight to the lines. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. I just got a few questions that I would like to ask the doctor.
Please go ahead.
Alright, number one, the doctor says not to check for a pulse. I think it's preferable to check for a pulse because not longer than 10 seconds, because a pulse is always necessary. Also, you're looking at breathing. Why don't you look at the airway as well? It hazards, hello, health, airway, breathing, circulation. Because if you have an obstruction in your airway, what's the use of giving mouth to mouth if there is an obstruction in the way? And then another thing is, if a person falls from a flight of stairs or something and the person needs CPR, why don't you train the people also like the head tilt and chin lift in the jaw thrust? Because what if the patient has spinal injury and you're giving CPR? That's also another issue.
Okay, doctor, would you like to ask something, or can the viewer listen on the television? Shukran so much to that questions. The doctor will answer, inshallah. Shukran so much.
So they've actually changed the way that we do CPR now. Shukran for the question, firstly. So they've changed the way that we're doing CPR nowadays. Initially it used to be so it's hazards, hello, help, and then ABCs. So one, they found that as lay people, we just take too long feeling for a pulse, and in a time of panic, we feeling our own pulse. We're not sure. Is this a 3D pulse, or is this my pulse, or is this the patient's actual pulse? So it's internationally there's international consensus on whether or not we should feel for a pulse, and for lay people, don't feel for a pulse. You just check for signs of life. And as I said, it's rather on the side of caution and say that, okay, this person doesn't have a pulse, and carry on from and start CPR earlier and abort if the person does have signs of life. The second question related to ABCs, so opening up the airway, then breathing for the person, and then going on to circulation. And they've changed it now to CAB, which is circulation, airways, then breathing. And the reason for that is we just take too long with the airway. And when your heart stops, you don't go breathe out all the air in your lungs and then collapse. You normally take a breath in. There's oxygen reserve within your chest when you do collapse and your heart stops. So there is oxygen reserve in your lungs. And then lastly, when we're doing CPR, you're actually moving air passively in and out of the lungs. Yes, it's not a great volume of air, but you are still moving it in and out of the lungs. The most important thing in CPR is perfusing your brain and perfusing your heart muscle, without which you cannot live. You cannot live without the brain. You cannot live with a brain that's had no oxygen for a prolonged time, and you cannot live with a heart that doesn't have any oxygen in it. And as I said, when you do collapse, it's not necessary to move. You don't exhale all your air in your lungs. You do still have a reservoir of air in your lungs. The last point that he mentioned was quite pertinent about the C-spine. From a layperson point of view, we try not to complicate things too much. Initially, everything used to be so rigid that people were scared of doing CPR. And if somebody who's fallen, obviously, somebody who's sustained trauma that needs CPR, the chances of survival is minute. It's minuscule. Because of the severity of the injury, because it's usually not a heart attack that's put him into cardiac arrest, or a infection that's put him into cardiac arrest. They've had major trauma, so they've probably bled out, and a layperson can't react to that. Obviously, for a healthcare professional, something completely different. But what we're doing here is we're trying to educate the layperson. And for the layperson, just keep it simple. It's hazards, hello, help, and then check for signs of life. If there's no signs of life, start with chest compressions, okay? If you then have a look and see, okay, my airway is obstructed, so after you've done your 30 chest compressions, you're going to go onto your airway. Once you've checked your airway and seen that there's no obstruction, you're going to breathe for the patient, as we demonstrated earlier on. If there is an obstruction, you're obviously going to relieve the obstruction. I think that's another talk for another day. The choking bit and obstruction and airway obstruction. But for now, all we want to do is we want to do chest compressions as quickly as possible. We're going to assess the airway and breathe for the patient, because that chest compressions that we're doing is passively breathing for the patient.
Yes, and as Doctor also mentioned, the patient or the person is already dead.
Yes.
So you can't really do any much more damage unless by helping. And as Doctor also mentioned about the Good Samaritan Act, you know, with that will probably be our intention to assist and to help. But shukran so much. Thank you so much to that viewer for calling. And the number still appears on your screen, 0216960109. Please make use of that and be part of our program of discussion. We're discussing CPR this evening. Doctor, we did see the visuals. We did see the video about how you basically demonstrated the CPR. Are there any additional information that you would like to share?
Yes. So as I said, we're doing CPR to temporizing while we get definitive treatment.
Correct.
And definitive treatment is a automated external defibrillator. So it's a shocking device.
Yeah. Is that where they on the television they
yes,
they do that?
But that's only
and
what George Clooney does.
Okay.
We never ever do that, because I think that machine is actually very, very dangerous, because it's a lot of electricity, and if you shock it against each other, it can be fairly dangerous. So the next video is a video of the AED that we can find at almost all your gyms. All the gyms will have it. Yeah. And then all our airports will have it as well. And then our bigger malls will have it as well. So Century City has one. The Waterfront has one as well. So the video should be coming up soon. It's video 3. And
there you go.
There you go. This is an AED. You will find it at most gyms and at airports.
So that will, as Doctor said, will be in your major malls.
The box containing the AED. Okay. Inside, you will find the AED and usually 2 sets of pads. A pediatric pad and an adult capable pad. This is an adult, so we will use the adult AED pad. Follow the steps 1, 2, 3. First step is to switch the machine on, and it will instruct you what to do thereafter.
Apply pads to patient's bare chest.
So it says apply pads to patient's bare chest. This one shows you where to put it. The pad will show you where to place it. Sticker shows you where to put it. Right there. And then placing.
Analyzing heart rhythm. Do not touch the patient.
Do not touch your patient.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange.
Clear. Make sure nobody is touching your patient. So that shocks the person. You might see a little jolt over there. And as soon as you've shocked the person, you start your chest compressions immediately. So this is...
Okay, shukran so much, Doctor, and I'm sure that the viewers enjoyed that. But I think it's very, very interesting. And Doctor said also that the machine, it will actually tell you where to put the pads on the body.
You just need to press number 1. Yeah. The machine will tell you exactly what to do. Yeah. On the pads itself, there's a little diagram showing where to place the pads on the body. Mm-hmm. If it's a child and you have that machine, you can use the adult pads for the child. Obviously, if you have the child pads, it's preferable. But if you don't have a child pad, use the adult pad. Doesn't matter.
And vice versa.
Most machines will have an adult pad.
Will have the adult.
Yeah. Most machines won't have the pediatric pad though. So that's what I'm saying. So if you have a child, use the child pad. if you have it. Otherwise, use the adult pad on everybody.
Shukran so much, Doctor. Doctor, maybe you can explain to our viewers also, in terms of the mouth-to-mouth, we did watch the video, but you're the expert, how you did it. What advice can you give us, the layman, how to basically apply the mouth-to-mouth?
Okay, so mouth-to-mouth, firstly, if you have that barrier device, so if you have that plastic shield, you can do mouth-to-mouth on anybody, okay? Our advice in South Africa is that if you do not have it and it's your family member and you're comfortable doing mouth-to-mouth on your family member, then yes, go ahead. Or it's somebody that you know and you're comfortable doing mouth-to-mouth on that person, then please, yes, go ahead, okay? But if it's somebody you don't know, we don't want you getting infected. We don't want you getting infectious diseases from that person because you don't know the person and you're not comfortable doing mouth-to-mouth. Don't do mouth-to-mouth, just do CPR. It's better than doing nothing. So just do the chest compressions and don't do mouth-to-mouth. But if you are going to do mouth-to-mouth, the correct procedure is, as a caller has indicated, you've got to do the head tilt chin lift. So what you're basically doing is, on the earlier video, what we demonstrated was you lift the chin up, okay? And that, all it does is just straightens out the airway.
Opens.
So yeah, exactly, it straightens it out nicely so that the flow of air is actually quite easy. You've got to seal your lips all the way around the person's mouth, and you've got to close their nose as well. Because if you don't close the nose, you blow in, it's just going to come out of the nose instead of going into the stomach. You don't want to go, so you don't want to go super fast, okay? You want to take at least, so it's like you're normally breathing, okay? But it's a deep breath in and deep breath out, okay? So that's the speed that you want to do it in. It's 1 second in, 1 second out. 1 second in, 1 second out. There's 4 seconds that you're off your chest, and then immediately back onto your chest again. Okay?
It sounds so easy, the way you explain it. So shukran so much, for that, because it can be very distressing for somebody that watches or witnesses somebody collapse, and you feel you can't do anything about it. But doctor, you're giving it to everybody. So thank you so much. And to all our viewers, call us 0216960109, anything relating to CPR. Doctors making things so extremely easy for us. Alhamdulillah, shukran so much. But we need to go for another ad break. But when we come back, inshallah, we want to know a little bit more of how long, do you actually continue CPR, and a whole lot of other goodies relating to how we can actually just save somebody within that 10 minutes, inshallah. So viewers, stay with us. We'll be back right after the short break, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to the last segment of the Islamic Medical Association of South Africa's Health Matters comprehensive chat. We're discussing CPR this evening, and the lines are still open, 0216960109. And Doctor is still here with me, explaining so easy for us to understand. Shukran so much, Doctor. Doctor, I would also just like to know, and I'm sure many of the viewers out there would like to know, for how long do you actually continue CPR?
Yeah, this is a bit of a difficult. It's a bit of a conundrum. This international literature shows that if you have done CPR, effective CPR, good CPR for 20 minutes, and from the beginning, so you've started CPR early and you've continued CPR for 20 minutes, and there's no resolution. The person his heartbeat hasn't returned. He hasn't. Actually, let's move away from the term heartbeat, because I don't want the public looking for a pulse. Look for signs of life, look for movement, look for breathing. If after 20 minutes there's no signs of life, stop CPR. The only times that we consider going on for longer is in young people that have taken an overdose, because their heart is structurally normal. So if a 20-year-old takes an overdose, their heart is structurally normal. They shouldn't have, if I continue my CPR, and I can give the appropriate reversal agents for that, I can go on for much longer. So after 20 minutes so normally after 20 minutes of CPR I would stop, but in a young person where I suspect the person might have taken an overdose, I would continue even longer. And in somebody that is hypothermic, so their temperature, so they're ice cold, Unfortunately, in South Africa, people don't die because they get cold. Well, in Cape Town at least. They are cold because they are dead. Obviously, if you're going to the Drakensberg, where there's snow, if you're going to the Cederberg, if you're a homeless person sleeping outside for the night on a very cold winter's evening, you can become cold and become lifeless from that. So yes, the only 2 times that we would go longer than 20 minutes, obviously there's 3 exceptions, but most times 20 minutes is when we would, after 20 minutes we would stop, except in persons who have taken an overdose, who we suspect might have taken an overdose, and in severely hypothermic patients.
Okay, shukran so much, Doctor. Doctor, how does CPR differ in children or in infants?
Okay, so we've got second last video, and it shows it just shows how one is the hand placement, and in a child we're only going to use one hand because they're a lot smaller than us.
Yes, of course.
We don't want to use the same amount of force. Yes, we want to compress to the same depth, so we want to compress to 5 centimeters deep as well in a child, but we don't want to compress with the same amount of force. So we're only going to use one hand.
Is
on
it
a
the
child.
full hand?
Yes, so it's a full hand. So I'm going to show a video now.
Okay.
So in a child that is older than a year old, it's one hand, again in the same position on the breastbone, between the nipples, and we're compressing to a depth of at least 5 centimeters, and we're going to compress 30 compressions to 2 breaths. Okay, so it's exactly the same. as a adult. So same depth, less force, okay, and the same ratio. Okay, if there's 2 people, we're not going to do 30 to 2. So we're not going to do 30 chest compressions, 2 breaths. We're going to do 15 chest compressions and 2 breaths. And the reason for that is in children, the most common cause of a arrest in children is not because they have a heart attack. It's almost never that children have heart attacks and have funny rhythms. But they usually have lung problems. Okay, and that's why we're breathing more frequently for children. But if we summarize it, if we're one person, it's still 30 compressions and 2 breaths. If there's 2 people, 15 compressions, 2 breaths. So this is just a close-up of how we do CPR in a child. And we're going to move on to an infant. So what is an infant? An infant is a child that is less than 1 year old. Okay, so it's less than a year old. So that's just closing off with the child quickly. And there's the infant. So with an infant, we don't want to use our whole hand. In an infant, so a child less than a year old, we're only going to use 2 fingers. And this is important because we do find this is so of the child population who gets cardiac arrest. It's children with cot death. Okay, so it's usually the first baby, young mother. It's usually during winter. They put baby into the cot and usually on their stomachs as well, and that's why we're advocating that babies sleep on their back. Back to sleep, the whole back to sleep campaign. So it's about a 6-week to 1 year old baby. Mom puts baby down into the cot on their stomachs, and mom goes to make food, or well, dad also can make food, but mom moves away from baby, comes back. So don't want to sound sexist on that. So mom or parent moves away from baby, comes back, and finds the child lifeless. So it's important to initiate CPR while you're getting the child to a hospital. So again, 2 fingers on the breastbone and press as deep as you possibly can. It's almost impossible to fracture a child's ribs because it's so elastic. And we think the opposite. Yes, exactly. So I mean, the child's ribs are made of cartilage, so it's very difficult to fracture a child's ribs. So if there's no signs of life, you don't see the child breathing, you handle the child, there's no signs of life, the child's not moving at all, there's no signs of breathing, start chest compressions and get that child to an emergency center as quickly as possible. Doctor, I've also noticed on your demonstration for the older child, you've been using the back of your hand in the center. So it's not the back of the hand, it's basically the palm. The palm of your hand. The lower part of the palm of the hand that goes onto the breastbone. Because that's where you are applying the most force. And then when you're doing your CPR, your elbows have to be absolutely straight. and your shoulders have to be in line. So when you're going over, your shoulders have to be directly over the breastbone as well.
Yeah.
That will make sure that you're getting the best amount of force possible onto your child.
Yes.
Or onto the heart at least.
Yeah.
So your shoulders should be directly over it, and then what it also does, it prevents you from pushing sideways, because if you're pushing sideways, you're pushing the lung. Okay? You don't want to be pushing the lung. You want to be pushing directly over the breastbone onto the heart, so that the heart can be pumping blood to the brain and to the rest of the body. So yeah.
Doctor, you mentioned now, with the cot deaths, maybe the mommy put the baby down and come back and the baby's lifeless. Obviously, it's your baby.
Yes.
And there is panic automatically. How do we keep calm by not panicking, I must say, if you want to basically assist your child?
So yeah.
we must basically just focus.
So it's
and listen what doctor just said.
CAB. Circulation, airways, breathing.
Yes.
Circulation. Do your chest compressions.
Yes.
Okay. Do it for 2 minutes, and then if we go back to the chain of survival again.
Yeah.
So obviously prevention. Okay.
Yeah.
So how do I prevent? How do I decrease the chance of my child having a cot death?
Yeah.
Back to sleep campaign. So
Right.
don't let the child sleep on its back. On its stomach. Sorry.
On its
they
stomach.
must. Yeah. So they must sleep on their back. It decreases chances of your child having a cot death. I'm not a pediatrician, but it decreases it dramatically.
Yeah.
So that's the one thing. So prevention. How do I prevent it? Sleeping on their back. Second thing, start with the chest compressions. So chest compressions, airways, breathing for 2 minutes. So you're going to do that for 2 minutes. Once you've done that, you're going to call for help, or you're going to move towards help, which is an emergency center, your GP, your local healthcare professional. And that is the most important thing. It is as a doctor, it's the most heart-wrenching thing when I see somebody coming in and they say, my baby stopped breathing, and it's 20 minutes, the house is 30 minutes away, and they come there and you feel absolutely helpless. If they had done the chest compressions, it would have increased the chance of that baby making it drastically.
And that's why we're having these type of programs, inshallah, of the Islamic Medical Association. And tonight in particular, it's CPR awareness. So please, what doctor is giving us, it's only to save lives. And definitely, if we can, with good intent, and something, doctor, that I think is very, very important, we cannot really do much damage to somebody that does not have any life.
Definitely, yes.
Yeah.
It's so important that people
I think we must drive that message also.
If there's no signs of life, if the person's not moving, if you don't see signs of breathing, start the CPR.
Start the CPR.
You can always stop. But every minute that you don't, that you're scared, that I'm not sure, that you're hesitating, the person's dying every minute by 10%.
Okay, all right.
You're killing that, or not you're killing, but the person is dying by 10%. If you start and you stop,
there's a chance.
If you start early, the chances are so much better.
Okay.
It's not 100%, but it's so much better.
Okay.
If we hesitate, we decreasing the chance by 10% per minute, and I think that's the most important thing that we have to take away from here.
Absolutely. Doctor, who's at risk?
Okay, so can we play the last video? So this is the video of, so anybody's at risk.
Anybody at risk.
Yes. The most important thing that we have to realize is, so this is a karate match. And look at the person on the left of your screen. Left of your screen.
What's that?
He's dead.
Has he just collapsed now?
He's dead.
He's dead.
Yes. This is we use this in medical training as well.
Right.
Okay. So when we think who's at risk,
Right.
if we go from youngest, it's the babies. So our cot death. So our children are the young babies are at death. Okay, sorry about that.
Shukran so much, Doctor. That was a very interesting little video, I must say.
So who's at risk? So it's obviously the young babies. So the first baby that's sleeping on their stomach, usually during winter, in a house where there's people smoking, Those are children at high risk of cot death. The second group and then obviously people with children with heart problems,
Heart conditions.
so they've got a cardiomyopathy, they've got irregular rhythms. Those are usually known to the parents. And then the third group if we're going slightly older, the third group of at risk is your children doing sports activities. So I don't want people to not do sports,
Yes,
okay?
yes.
But it's more an awareness to schools and to tournament providers if somebody collapses during a contact sport. So what types of contact sport? Karate is one of them, very importantly. Now recently we had a young rugby player who it was just before one of the Western Province rugby matches. They had the opening match for Western Province. So it was one of the club players before the official Western Province match, and he had a cardiac arrest. And then there's two people that had a cardiac arrest. They're both soccer players.
Yes.
And I know how people, all Man United supporters. I'm not a Man United supporter, by the way. But the top person is Fabrice Muamba. He plays for West Ham United in England. He had a cardiac arrest on field. They did CPR from the word go for an hour and got him to hospital. And he's alive. He's well.
For an hour?
They did CPR for an hour.
Wow.
From the word go, they did CPR for an hour. And he's fine.
Okay.
He's absolutely fine.
Okay.
The second person is for Piero Mauro Morosini. He's an Italian club player. Exactly the same condition that Fabrice had. And what they did there was they waited for the ambulance to come. How long did it take for the ambulance to come? 9 minutes before the ambulance arrived on scene.
Yeah.
Nobody did CPR until the ambulance came. So everybody watched.
Yeah.
He's dead.
Yeah.
What are we going to do?
Yeah.
We all scared. We don't know what to do. Nobody initiated CPR. And he's dead.
Oh, wow.
So, and that's the important bit that we have to take away from it.
Yeah.
It is initiate CPR early. You can always pull away, but initiate CPR early. And I think that always drives my point home.
Yes.
It is the two soccer players, exactly the same condition. And one received CPR from the word go. The other one didn't receive CPR. The one has a fantastic outcome. The other one is dead. And then the last group of people that are at risk are obviously elderly people. So mainly over the age of 45. And it's usually because of the increasing burden of coronary artery disease. So people that get heart attacks or at risk of heart attacks. And they also obviously at risk of having a cardiac arrest and requiring CPR.
Doctor, is mouth and nose, because I've witnessed once, the person gave the CPR, but the mouth to mouth, but the nose and the mouth was covered. Can you do that?
You can. You're going to need a very big mouth though, because if you saw the videos earlier on, when I did mouth to Barry device, I struggle on an adult to encircle their lips.
All right. Shukran so much, Doctor. Doctor, we need to close our program. And shukran so much to our viewers for tuning in to the Channel 347. And to you, Doctor, for being here. Once again, shukran so much. And also our viewers, thank you very much for tuning in. And next week, inshallah, we will be doing breast cancer awareness with another IMA member. We want to wish you a beautiful and healthy week ahead. في أمان الله والسلام عليكم ورحمة الله تعالى وبركاته.